Today we're going to talk about Asian nose surgery and how we go about assessing the nose and then what is an aesthetic result in Asian rhinoplasty or Asian nose surgery. When a patient comes into my office, what I do is during the consultation, I'll make a facial assessment. So I'll look at the face and divide it into the upper third, middle third, and lower third and see if those three pieces of the face are in balance. When I'm looking at the nose, I'm looking at does the bridge start in the right place? So ideally you want the nose to start about where the eyelashes are. And then you want to have a straight bridge, and then you want to have the tip of the nose slightly higher than the line drawn by the bridge. I'll then look at the chin to see if the chin is in the appropriate location to make sure that the chin and nose are in appropriate balance. Now with Asian nose surgery, I'm going to present to you kind of an advanced concept, which is that although most people think about raising the bridge and people are fixated on the bridge, when plastic surgeons and other nasal surgeons analyze each other's work, what we really look at is the tip of the nose, because the tip of the nose determines the quality of the result. Is the tip appropriately projected? Does it stand well? Is it a good shape? Those are the things we're really looking at, because that's the hard part of a nasal operation. Now, here's an example of a 46-year-old woman who didn't like the way that her nose looked. And if you look at it, she's got a relatively high bridge, but the problem is the tip's a little too low. So what I did for her was slightly shave down that bump that's in the middle of her nose, and then I used cartilage from behind her ear, and then I used it to raise up the tip of her nose. And you can see how aesthetic that nose looks. Here's a second example. This is a 25-year-old patient who had nasal surgery out of the country, and she wanted a more aesthetic result. When I look at it, the bridge is in good position, but the problem is the tip's too low because the tip was not addressed. In addition, the chin is a little bit set back or a little bit protruded. So the way I addressed her was I took ear cartilage, again from behind the ear, and placed it into the tip of her nose, and then I placed a chin implant made through an incision inside of her mouth to give her face good balance. Next patient is a 21-year-old lady who wanted to have a more pleasing nasal shape. And so when I analyze her face, the bridge is high, but it starts a little bit below her eyelashes. So what I want to do for her is make the starting point of her nose a little bit higher. And then I want to raise the tip of her nose so it's a little bit higher than her bridge line. And then when I look at her chin, it would look a little nicer with slight more projection. And so those are the things that I addressed for her. I put in a silicone implant in her bridge. I put ear cartilage in her tip of her nose, and then I put in a chin implant. And you can see it's a much more balanced profile. And finally, I'm going to show you a 23-year-old woman who has a pretty nice nose, but she just wanted it a little bit bigger. So what I did for her was raise her bridge, raise the tip of her nose using septal cartilage, and that's the tissue that's inside of your nose separating your two nostrils. And then I placed a chin implant. Now, part of the reason why I've only been showing you profile views is that when you see a frontal view on camera, it doesn't show a very dramatic effect. And you can see this is about a 3-year follow-up. Not much change on a frontal view on camera. In real life, there is a pretty dramatic change. Now, a frequent question that comes up is, what do I use on the bridge of the nose? There are many materials we can use. There is silicone plastic, also known as silastic, and that's probably the most popular. This is different from the silicone involved in the silicone breast controversy. And silicone plastic has been used for over 50 years very safely. One of the newer materials people talk about is Gore-Tex. And Gore-Tex is okay, but it works better in very thin sheets. And it doesn't work so well in Asian rhinoplasty, I find, because there's only one maker of the Gore-Tex implants, and they just have one shape and that's it. So it makes it a little bit harder for us to tailor the bridge to the individual patient. There are other materials such as Porex and so forth, and that's a little bit less popular. Some of the natural tissues people have used along the bridge would be rib cartilage or skull bone. And those things, although appropriate for reconstruction cases, generally I find that the patients don't like the amount of surgery involved in harvesting the material, and then it's very hard to carve the material down into an appropriate shape. So most of us go with the silicone plastic implant. The tip of the nose, which I've been talking to you about, can be raised through a variety of materials. One tissue is the septum, which I alluded to earlier, and that's the tissue from inside of the nose. One of the problems is the septal tissue is very thin, and also it doesn't stay up very rigidly over time. And so if you have very weak septal tissue, then we generally have to go to another source. And here we're talking about ear cartilage. I would say the majority of the time I use ear cartilage because it's a very consistent material. The ear cartilage is harvested through an incision from behind the ear, and then the ear will go back to completely normal shape, and the incision is hidden behind the crease of the ear, so you're not going to see much of a scar. I don't recommend using a silastic implant at the tip of the nose because this tends to thin out the nose, and you're risking extrusion of the material right through the skin. In summary, the great majority of us prefer silastic or silicone plastic materials because it's been around the longest, it's proven to be safe. There's a variety of shapes that can be tailor-made to each patient's nose. I'm going to show you another patient. It's a 25-year-old who requested correction to make her profile look a little better. And when I analyze her face, her bridge starts too low, so it's below the lash line, and her tip is too under-projected, or there's not enough projection to the tip, and then her chin is a little bit protruded. In addition, her face laugh line is a little deep, so she wants that opened up a little bit. What I did for her was take the hump down and then put in a silicone implant so that the nose starts in the appropriate position. I use ear cartilage to project the tip of her nose, and then I put in a chin implant through the inside of her mouth. In addition, I put in an implant right at her laugh line to open up her profile more appropriately. On a frontal view, one change you will see pretty dramatically is someone with a flared nose where the nostrils are a little bit wide. Those can be narrowed through an incision placed right along the groove of the nose. It heals pretty well in non-smokers. It's very hard to see when it's fully healed. And so I don't hesitate to do that operation unless you smoke. If you smoke, I'm probably not going to recommend the procedure. Another topic that comes up is, should the operation be performed through an open or closed incision? If there's a lot of tip work to be done, it's very difficult to do the entire thing without seeing what you're doing. So I think many surgeons prefer to make a very small incision between your nostrils to place the graft material so that it's not crooked and you don't have to go back to have multiple revisions that can result if you try to do the operation blind. So most of us prefer to make a small incision, and you can see in this photograph here that it heals quite nicely in most cases. So I want to point out finally that with nose surgery, we're not looking for huge changes. We're making very small changes, and it's a very delicate operation. But when you put in a small change on the nose, a little bit of a bridge, a little bit of a tip, a little bit of a chin implant, and possibly a little eyelid surgery, when you add it all up, the cumulative effect can be quite dramatic.